explain to the patient is that your body works like a city. In a city, you have the policemen that are making the traffic. You have the drivers that are driving circulation, and you have also the building industry. You know, when you have, how could you say that? How do you say when in town you have a part of the circulation that is blocked because people
construction.
Yeah, exactly. So you have constructions, but if you want a city to work properly, you need to have a regulation between the construction workers, the drivers, but also the policemen. Because if the policemen just block everything, that doesn't work. The circulation doesn't work. And this is exactly what happened in scleroderma. Your circulation doesn't work. That's the blood circulation, but this is some kind of circulation. And at the same time, you have the construction workers who work too much. And this is fibrosis, you know, this is as if they were constructing everywhere. And that's it. And the other aspect is that the policemen that would be supposed to help the circulation, they are overactivated too, and they're blocking every circulation, allowing the workers to work too much. And that's exactly the same aspect. And in a normal way, what should happen? You would have signs, you know, circulation signs in the city to say you can't drive here, or you can. And this is exactly the idea. You have messages between the policemen and the drivers based on these signs, but also between the drivers and the construction workers based on these signs too. And in scleroderma, there are too many signs, too many messages. And you're supposed exactly the same way to look at which signs create this disorder and create the malfunctioning. And this is exactly what we are doing with the biorepository, is to understand what the signs mean and how can we properly, you know, recreate a normal way of functioning between the policemen, the immune system, the construction workers, fibrosis, and the circulation, the drivers, and the blood circulation, the Raynaud's phenomenon. But that's exactly the same concept.
You just did what a teacher does. You put a very complex scientific disease process and you made it down to real life.
It's exactly true. These really are the policemen that are stopping the traffic just to help the construction workers, but as a consequence, the construction workers, they construct too much, and this is fibrosis. This is really that. So, but this is how I explain the disease to my patients, and they understand it. But for some patients, the real problem is the circulation, the traffic. For others, this is the construction workers that are really working too much, and this is really the problem. And for others, this is the policemen that are getting crazy, and we just need to, you know. But in all the disease, there is these parts of the city that are not working properly. But depending on the patient, some aspects are more important. And I would say that yeah. So what would you say? Would you say go blue?
Yeah.
So go blue, go Given Blue Day, and go vaccine when you can.